Good morning. Our presentation today is about acne. This is a common condition that happens when all hair follicles become clogged with oil, dead skin. The cells get plug the pore, and the outbreak of lesions called pimple or zits can happen. Most often, the outbreaks occur on the face, but it also appears on the back, chest, and shoulders. People of all races, ages get acne, but it is most common in teens and young adults. When acne appears during teenage years, it is more common in male. Acne can continue into adulthood, and when it does, it is more common in women. What causes acne is too much oil in the pore, buildup of dead skin in the pore, bacterial growth in the pore. The following factors may make it more likely to develop acne: hormones, family history, medication, and age. The following do not cause acne, but it may make it worse: certain food, stress, pressure from sports, helmets, tight clothes, backpack, pollution, high humidity, squeezing the acne and pimple, scrubbing the face too hard. The symptoms of acne depends on the severity of the condition. It could range from whitehead, which is closed plugged pore, to blackhead, open plugged pores, small red tender pimple, which is like papule, pimple pustules, which are papules with pus at their tips. There are large, solid, painful lumps under the skin. These are nodules. Painful, pus-filled lumps under the skin, cystic lesion. Acne can appear on the face, forehead, chest, back, upper back, and shoulders. The symptoms of acne, as we said before, it is pimples and pustules, which is the pus-filled bumps, papule, small discolored lump, often red or purple or dark than your natural tone of skin. Blackheads, plugged pore with a black top, whitehead, plugged pore with white top. Nodules, large lump under your skin that are very painful. Cystic, it is painful fluid-filled lumps under your skin. Acne can be mild and causes a few occasional pimples. It can be moderate and causes inflammatory papule, or severe and causes nodules and cysts. There are several types of acne, including fungal acne, which is 𝒅𝒐𝒏'𝒕 folliculitis. The fungus acne can appear when the yeast build up at the hair follicle, and these can be very itchy and inflamed. Cystic acne causes deep pus-filled pimples and nodules. These can cause scars. Hormonal acne, it affects adults when there is overproduction of sebum that clogs their pores. Nodular acne, a severe form of acne that causes pimples on the surface of your skin that are tender, nodular lumps under your skin. All of these forms of acne can affect your self-esteem. Both cystic and nodular acne can lead to permanent skin damage in the form of scarring. It is best to seek help from healthcare provider early so they can determine the best option for you. The causes of acne, as we said before, it's a clogged hair follicle or pores that causes acne. Your hair follicle are small tubes that hold a stand of your hair. There are several glands that empties into the hair follicle. When too much material is inside the hair follicle, it clogs. Your pores can clog with sebum. It is an oily substance that provides a protective barrier for your skin. Bacteria, small amount of bacteria naturally live on your skin. If you have too much bacteria, it can clog your pores. Dead skin cells, your skin cells shed, often to make room for more cells to grow. When your skin releases dead cells, they can get stuck in your hair follicle. When your pores clog, substance plug up your hair follicle, creating a pimple. This triggers a series of inflammation, which may feel as pain and swelling. You can also see inflammation through skin discoloration, like redness around the pimple. The ranking of the acne, it did about 4 grades. Grade 1, where it is the stage of the blackhead and whitehead with a few papule pustules. Grade 2, it is more moderate or pustular acne, multiple papule pustules. Grade 3, it is moderately severe or nodulocystic acne, which is numerous papule and pustule along with inflammation. Grade 4, it is severe nodulocystic, numerous large, painful, inflamed pustule on the skin. Medication can range from oral, topical, oral, and other medication. Oral medication, antibiotics can treat acne caused by bacteria. Common antibiotics used: tetracycline and its derivative, minocycline, doxycycline. These are the best for moderate and severe acne. Isotretinoin. Isotretinoin is an oral retinoid that shrinks the size of the oily gland, which contributes to acne formation. Contraceptive pills. It is approved by FDA for treating acne. It's a form of birth control. Some brands like 𝒍𝒊𝒃, Bias, orthotetracycline, Yaz, these pills contain combination of estrogen and progestin that helps to regulate hormone production. Additional acne therapy is topical oral medication. If they do not work, they do not work for acne. A healthcare provider may recommend different types. Like hormone therapy, it is helpful for those people with acne, especially if you experience acne flare-up during menstruation or irregular period caused by excess acne, excess hormone, androgens. Hormone therapy consists of low-dose estrogen, progestin, which is the birth control pill, or oral medication called spironolactone that block certain hormones at the level of your hair and oil gland. Topical medication, healthcare provider may recommend topical acne medication, which is mostly the first thing that the health provider start with. You can rub it on the skin, directly onto your skin, as would be a lotion or moisturizer. These could include products that contain the following ingredient: benzoyl peroxide, which is available over the counter. I leave the rest for you. Salicylic acid, available over the counter for acne as a cleanser on a lotion. It helps to remove damaged skin as its exfoliator. Azelaic acid, this is natural acid found in many grains like barley, wheat, and rye. It kills microorganisms in the skin and reduces the swelling. Retinoid, a retinol is a retin A, 𝒍𝒔𝒄𝒄, which is available throughout prescription. It breaks up a blackhead and whitehead and helps prevent clogged pores, first sign of acne. Most people are candidate for retinoid therapy. Antibiotics, topical antibiotic like clindamycin or erythromycin control surface bacteria that aggravate acne. Dapsone, it's a topical gel which also have antibacterial and affect inflammatory acne. Steroid can be used for treat severe acne by injection into the nodule of the acne. Laser therapy, there is light laser therapy that treats scar. Laser can deliver to the scarred collagen under your skin, relies on your body wound healing response to create a new healthy collagen. Chemical peel, applying different chemicals to the skin to help to exfoliate the damaged skin and the appearance of a new one. Antibiotics can be used, and as we said before, it kills the bacteria that enters the body and destroys the bacterial flora, and the healthcare provider recommend antibiotic if you have acne caused by bacteria, if you have infection. Antibiotic rid the infection if the bacteria gets into popped pimple, which causes becomes painful. As we spoke about hormones, acne is largely hormonal, that is driven by androgen, testosterone. This typically become active during teenage and early adulthood. You might also notice acne forming around the time of your menstrual period. Sensitivity to the hormone with combined surface bacteria on your skin and substance released can cause acne. To manage acne at home, you need to wash your skin at least once a day with warm, not hot water. Get a gentle cleanser. There are many cleansers that you could think of. Washing the skin after you exercise or sweat. Avoid using skincare product with alcohol, astringent, toner, and exfoliant, which can irritate the skin. Removing your makeup at the end of the day or before you go to bed. Choosing an oil-free moisturizer to apply to your skin after cleansing. Avoid popping, picking, squeezing the acne. Let the skin heal naturally to prevent scars from forming on your skin. If at-home skincare did not work, then you need to go back to your health provider. Now, the treatment of acne should be tailored to the individual need, stage of acne, type of skin, and general health. No particular treatment is separate for a particular patient. The treatment comes collectively. The simplest and to start with are the topical and non-chemical, and then we move forward from one to the next according to the severity of the acne. Thank you very much for listening. I hope you enjoyed it, and if you have any question, you're more than welcome to write.